Lurasidone, brand name Latuda, is an atypical antipsychotic used to treat symptoms of schizophrenia and bipolar disorder. It works by increasing the levels of certain chemicals in the brain called neurotransmitters, including dopamine and serotonin. This mechanism of action helps regulate mood and reduce symptoms such as hallucinations, delusions, and disordered thinking. Lurasidone is used as a monotherapy to treat schizophrenia and as an adjunctive therapy to lithium or valproate for acute manic or mixed episodes of bipolar I disorder. For schizophrenia, the starting dose is 40 to 80 mg once daily with food with maximum dose being 160 mg per day. For bipolar depression, the starting dose is 20 mg once daily with food with maximum dose being 120 mg per day. The maximum dose may vary depending on the patient's response and medical history. As with most medications, there may be side effects associated with the use of lurasidone. Common side effects include headache, nausea, vomiting, minimal weight gain, constipation, and restlessness. Other serious side effects include increased risk of suicide, increased risk of death in elderly patients with dementia-related psychosis, and increased risk of orthostatic hypotension, or low blood pressure upon standing. Some of the laboratory tests that may be needed before starting the antipsychotic include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with lurasidone.